with UNC, it's like if you have any type of sports medical issue or
Mm-hmm.
orthopedic issue, go.
Uh-huh.
But if it's not that, you're better off somewhere
Cool.
else.
Listen, I'm gonna try this out. You have a good history here. Can I won't use your name. Can I and I don't have you on camera. Your voice might come through, probably will come through. Can I just get this? I won't use any of your demographic info. Is it okay if I just go through your history and just go over it a little bit?
Yeah, as long as there's no
No
identifiers.
identifiers whatsoever. Cool. I also like to, while we're here talking, I like to give doctors. I don't even know if this damn thing is on. I'm not seeing the green come on. I might end up just chucking this video. It might be a shit video without audio. But I like to school doctors on how to do the HIPAA compliant patient interview. I put these up on YouTube, half so they can get so doctors can get schooled on how to do the cannabis thing, what to talk to with patients, how to get a good history, but also how to do this sort of thing. Not many doctors do this.
Not at all.
How to do this sort of thing. So it's like, look, here's a patient history. This is how you get a history. This is what you do with it. That sort of thing. So thank you, sir, for that. With no further ado, let me just see if I can dig into it. All right, so cool. Good young patient here. Late 20s, early 30s. I'll say that. Looks well. Athletic guy. History of cluster migraines lasting for 4 to 6 weeks. Secondary to 17 plus concussions. Also with GI disorder, IBS, borderline Crohn's, right shoulder pain secondary to many shoulder dislocations. How many did you say? 10 plus?
10 plus.
10 plus shoulder dislocations happening since 16 years old for, I guess, 14 years now.
Not
All
the
right,
shoulder. Everything
no,
but the shoulder. But
right, everything but the shoulder. I guess the cluster symptoms and whatnot.
yeah.
So, all right. So, currently treating very high doses CBD, ibuprofen, exercise, smartly using diet to prevent clonazepam when nothing else is working, and also previously sensory deprivation therapy and oxygen tank. So, the reason why I wanted to present this particular this particular case, this patient, is really just because you've tried a whole lot of things. You've taken. I always applaud patients when they take their health into their own hands and try and just stick with the program and do the healthy thing and do what they think will work. Already tried the cannabinoid with CBD. Are you new to cannabis? Are you new to THC containing
Not at
products?
all.
No, not new. Excellent. Good. Physicians watching, it's good to just get a baseline idea, even if it's a first patient certification. If doctors are doing certifications, just get an idea, non-judgmentally being the key here. If someone has experience with cannabis, I'm not really curious whether or not that experience came in Colorado, California, a medical state, a recreational state, whether it was legal, illegal. I don't care. I don't care. Right? I'm a physician. I'm not a lawyer. I don't care. If they're experienced with cannabis products, with THC containing products, that answers the question of whether or not I want to go over risk and benefit to that extra degree of detail with them. He has firsthand knowledge. He probably already understands cannabis can give one a dry mouth, red eyes, feelings of euphoria. If you get yourself too high, maybe fall asleep. If you use too much of a sativa strain, might aggravate anxiety, that sort of thing. He already, he's already up with it. So I'm just gonna with this sort of thing. I try not to belabor it with the patient and pepper them with unnecessary questions when I've already obtained the history. Very clear here again: migraines, shoulder injury, a lot of concussions, tried a whole lot of stuff: CBD, sensory deprivation therapy, ibuprofen, the whole nine. Clonazepam only as needed. The great thing about getting the cannabis card, now he's going to be able to hopefully mitigate possibly the clonazepam usage, maybe the ibuprofen, really just cut down on the pharmaceutical load. I guess that was his mindset. I
The
guess
ibuprofen, especially, because that's what messes with my stomach so bad.
common.
Because
This is
that's what I have to take most often. Like if I have to take anything, it's 2 or 3 ibuprofen at a time in order to kick anything, plus a cup of coffee with it, and it wrecks me.
That's super good info. Thank you for that. You know, the idea of mitigating the over the counter medication usage, that's a real thing. That's a real thing, because these things the most common thing is GI irritation. These things, ibuprofen is cleared by the kidneys. Okay, so the amount of renal stress, I feel like this light, oh, it's because I'm blocking it. Gosh, doctor, where is your brain? I was wondering why it was dim. Duh, the laptop was screening it. Stupid. But yeah, anyway, sometimes doctors do stupid stuff. I'm no exception. Anyway, there, I said it. There, I said it. Gosh. So, but yeah, mitigating the NSAID usage, be it ibuprofen, naproxen, aspirin, Tylenol, okay, Tylenol especially because cleared by the liver and can be toxic in higher doses. Let me inch this thing up. It's just not bright enough. Yeah. It's a good idea just to maintain the health of your GI tract and limit the side effects. I think going the cannabis route can really limit that and just allow more mileage for the gut because I guess in your case, sensitive gut, right? There's stuff going on. Great.
I already have to take. I generally about quarterly. I do. Garden of Life has a 400 billion count of probiotics. It actually comes in like a powder form,
Mm-hmm.
and once quarterly, I do like it's a 5 day regiment of
Mm-hmm.
400 billion a day, and I do that quarterly. And
Mm-hmm.
that's like the only thing that keeps me digesting at all.
Right.
Like, but
Right.
especially with all the ibuprofen, like whenever if I go through a cycle with the migraine, I have to do probiotics immediately afterwards.
Understood. That makes sense. So, really good credence here to probiotics. I probably don't talk about that nearly enough, but as far as gut health, just a really good adjunctive thing. Really in the realm of wellness medicine, I don't just talk about the CBD and the cannabis and THC stuff. It's really just from the standpoint of overall wellness and the probiotics. You see here a quarterly 5 day cycle of that. Really good idea. Thumbs up on that. Really great history. Thank you for that. I really do appreciate that. Docs and people out there, just pay attention. Really important to get a good history on the front end with patients so that we can just advise them a little bit better in terms of overall wellness. And in this case, certifying for their cannabis card. Good experience from him. Thank you again. I'm going to lock off the camera for that.